So this is an interesting thing about the aesthetics of the nose. There are a lot of little nuances, but here's something. I was actually just pointing this out to a patient because we just took her pictures. And so if you come over here, and I'm going to do a whole other video on this, I call them illusions of the nose. It's not just about taking the dorsal hump down. It's not just about deprojecting. It's about understanding all the little things that contribute to the overall appearance of the nose. So in this case, if on quick view you go, wow, what a great result, nice improvement, but it's not just a reduction in the bridge. It would seem that way to the naked eye, but if we just did a reduction in the bridge, it would not look this good. Why? One, if we did a reduction in the bridge, this part right here, the radix, would still be very flat and you wouldn't see a distinction between the forehead and the nose. So if you actually look at the eyelashes, we brought the radix down in a little bit. Not much on her. A lot of patients, we bring it in more. That's one thing. The other thing is, when we brought this down, we deprojected the nose, because when you bring this down, obviously you have to deproject. But if we only deprojected the nose would look very short. Why? Because in the lip here, this part was tensioned up. It looks like her lip comes up and then this part goes right up into the nose. So if her nose was deprojected, this from the top point would look good, but if you look from the bottom, it would look really short. So if you look at the after, we also brought in this area over here. So this whole area is called the columella. This is the nasolabial angle, nose, labia, lip. So this angle right here, we brought this in, so now it's not as open, but now that's brought in, so we were able to deproject, bring this down proportionally, and do that. So she's actually 3 months out, so she still does have a little bit of swelling kind of all throughout, but I just wanted to take the opportunity, because I was explaining it to her, of it's not just a deprojection, it's all the little things, and we talk about this when we do consults, I talk about this when I'm doing all my planning, as far as, okay, we're gonna bring this down, we're gonna deproject this proportionally, but let's look at all these other things. Again, I call them illusions, because one thing on the nose can throw off something else. So you gotta pay attention to those things.